All right, welcome in everyone for another deep dive. Today we're looking at what leads to kids entering the care system.
Okay.
We've got a whole stack of articles here from Community Care,
Right.
which, as you probably know, that's like the big source for social work news in the UK.
Yeah.
And we'll be focusing specifically on England and Scotland.
It's good.
And get this, some of these headlines suggest that the number of children in care is actually falling in some places.
Yeah, that is interesting. It's kind of a surprising trend, right? When you think about all the pressures families are facing these days.
So that's what we're hoping to unpack a bit today. What's going on here?
Yeah, definitely. I mean, it could be that support services are just doing a better job, intervening early, preventing families from hitting that crisis point where they need to separate.
So maybe things are moving in the right direction, though.
Yeah, maybe. It's probably too early to celebrate, though. I mean, we need to look at the long-term trends here.
That's true.
One year's data doesn't tell the whole story. Things like changes in the law or how cases are recorded, that can skew things.
Makes sense. Okay. Well, one big development is that 600 million budget increase announced for social care.
Mm-hmm.
Seems like a win on the surface, right?
You would think so,
Right.
but there's actually some concern from sector leaders about this.
Really?
Yeah, they're worried a lot of that money could just get eaten up by rising wages and employer taxes.
Oh, I see. So it might not actually translate into more support for the families on the ground.
Exactly. We need to make sure the money's reaching those frontline services, the ones that directly support children and families. If not, well, the impact could be pretty minimal.
Okay, yeah, that makes sense. And speaking of those frontline workers, one article talks about a drop in social work students in Scotland.
Right.
It's the second year in a row now.
Yeah, that's worrying. It raises some big questions about the future of the profession.
For sure. Like,
Yeah.
if there are fewer people coming in, who's going to be there to provide that support down the road?
Exactly. Think about the impact on existing social workers. Their caseloads are already often overwhelming. What happens if they increase even more?
Yeah, and this is all happening while, according to another article, social workers have less time for learning than they did a year ago. So not only are they overworked, but they're also not getting the chance to upskill, learn the latest best practices.
Yeah, it's a bad combination.
It is definitely concerning.
Yeah. I mean, you've got overworked social workers who are also not getting the chance to develop professionally.
Yeah,
Leads to burnout, high turnover, and then the staffing shortage just gets worse.
definitely a vicious cycle there.
For sure. We have to figure out how to address these systemic issues if we want social workers to be able to do their jobs properly, provide the best possible support.
All right, so we've got this budget increase, which, potentially a good thing, but we also have to think about where the money's going. And will it actually address those kind of underlying problems in the system? This actually connects to something else we wanted to talk about. There's 44 million pounds specifically allocated for kinship and foster care.
Right, right.
So what could this mean? What kind of impact could this have?
Well, kinship care is when children are looked after by relatives or close family friends. And then foster care, that's when children are placed with trained and vetted families. Both are absolutely vital for providing stable, safe environments for kids who can't live with their birth families.
Got it. So this funding could really boost those families who are stepping up to help maybe provide more resources and training.
Absolutely. Things like financial assistance, to help with the costs of caring for a child, or specialized training so that kinship and foster carers have the skills they need to support these kids who've often been through very difficult experiences.
It's good to see that commitment to these alternative care settings. But at the same time, I'm thinking, will the funding be enough to actually overcome those challenges?
That's a great question. I mean, there are so many factors at play, right?
Totally.
It's not just about money. You have to think about the quality of the relationships, the support services available, the overall well-being of the caregivers.
So many different pieces to the puzzle.
Right.
Okay, and for our last topic in this section, let's touch on the introduction of these new agency social work rules in the UK. Can you break that down for us a bit?
Sure. So agency social work, that's when social workers are hired on a temporary basis.
Okay,
It could be to fill in gaps in staffing or to bring in some specialist expertise.
makes sense.
And these new rules, they're basically meant to regulate that, make sure that anyone coming in through an agency meets certain standards.
So like qualifications and training and stuff.
Yeah, exactly. It's all about ensuring that whoever's working with these vulnerable children is qualified and properly trained.
It's definitely a balancing act, though. right?
Yeah.
We need to meet those urgent staffing needs, but also ensure the quality of care doesn't suffer.
Absolutely. And that's where these new rules come in. It's about finding that balance.
So much to consider.
Yeah, it's complicated.
Yeah. So we've covered falling case numbers, budget increases, staffing shortages, and then touched on those changes in kinship, foster care, and agency social work. It's a complex picture, for sure, and we'll dive back into it right after this break.
Looking forward to it. Yeah, it really is a lot going on. And as we go through these articles, it's just good to remember these stats and debates and all that. Those represent actual people, real lives affected by this whole care system.
So easy to forget that, right?
Totally, you get lost in the numbers. But every data point is a kid's life, a whole family's story.
And each of those stories is so different, shaped by so many things, family stuff, economic pressures, what supports are available.
Right, exactly. And whether those supports, those interventions are even effective, it's a whole ecosystem.
So how can we, I don't know, get a better grasp on those individual stories? What questions should we even be asking here?
Well, that's the million-dollar question, isn't it? And I think a good starting point is acknowledging that there's no one-size-fits-all answer. When it comes to child welfare, every situation is so unique, you have to be nuanced. You have to personalize the approach.
So instead of looking for the answer, it's more about figuring out what each kid, each family actually needs, like what's really going on in their lives.
Exactly. And to do that, you need social workers who are not just skilled, but compassionate. But you also need the system itself to be flexible, responsive, no cookie cutter solutions.
And that makes me think back to that article about the problems social workers are dealing with. Those huge caseloads, not enough time to really develop their skills. If we want them to be able to give that individualized support, we've got to address those bigger issues.
Totally agree. We have to invest in the social workforce, give them the resources they need, the training, the support. And I mean, not just so they can survive, but so they can actually thrive.
Right, it goes beyond just throwing money at the problem. It's about things like making those caseloads manageable, making sure they have good supervision, good mentors, and chances to keep learning, to stay up to date.
Couldn't agree more. Supporting social workers, that's ultimately supporting the families and children. When social workers are empowered, when they feel supported, they're better able to provide that really good, compassionate care. And that leads to better results for the kids, for everyone. It's a ripple effect.
It all connects. So to kind of recap here, we've talked about understanding those individual stories,
Hmm.
that we need personalized approaches, and about how important it is to support social workers. What else should we be taking away from all this?
One thing that really jumped out at me is how much the care system is always changing. New problems popping up, new policies, best practices always evolving. It's dynamic. So we have to stay informed, stay engaged in these conversations about how to make things better.
Yeah, it's not enough to just understand where we are now. We have to be ready for what's next.
Absolutely. The care system has to keep adapting to meet the needs of the children and families.
And that means being willing to question those assumptions, to challenge how things are done, and maybe even shake things up a bit with some innovative solutions.
Totally. And we need to learn from people who've actually experienced the care system firsthand. The children, the families, their insights, they're so valuable. They can help us shape a system that really puts children at the center.
This reminds me of the article on those new agency social work rules. It seems like there's more awareness now that we need different models of care to meet those diverse needs. One size doesn't fit all.
Yeah, good point. And bringing in these regulations, I think that shows a willingness to at least try different approaches to staffing,
Yeah.
to how those services are delivered. It's a sign that the system's becoming more flexible, maybe.
Do you think that's part of a bigger trend toward more flexibility, more innovation in the whole care system?
Could be. It'll be interesting to see what the impact of these rules is and to keep looking for those creative models that can make the whole system more effective, more responsive.
It's been a lot to unpack. We've looked at the trends, talked about the real human stories behind the numbers,
Mm.
and really highlighted how crucial it is to support those social workers.
Mm.
And I got to say, as we get near the end here, I'm left feeling, I don't know, kind of hopeful, but also aware of just how many challenges there are. Like we're at this crossroads.
I agree. I think the system's grappling with some really, really tough issues. But it also has the potential to make such a difference in the lives of vulnerable kids. And as long as we keep having these conversations, keep questioning things, looking for new solutions, I think we can create a system that's truly dedicated to the well-being of every child.
That's a great image to end on. But before we go, let's bring our listeners into this. We've looked at the big picture, but now we want to hear from you. What are you thinking about all this? What questions do you have about the UK's care system? What are your concerns? And maybe most importantly, what can we all do working together to make things better for these kids? It's important to remember the human side of all this,
Yeah, for sure.
to really think about what those individual journeys are like.
Right. At the end of the day, it's all about the children and families actually living through this.
Exactly. Like, what's it actually like for a kid who's taken away from their family and put into care?
Yeah.
What are they going through? What helps them?
And what about the families? I mean, what leads to these situations where they can't stay together? How can we support them better?
These are tough questions.
Yeah, they are. But I think if we want to start finding answers, we have to really listen to the people who've been there. The kids, the families who've experienced the care system firsthand. Those stories, those insights are invaluable.
It's like we were saying before, supporting those social workers is key. But we also need to be supporting the children and families directly,
Right.
making sure they have access to things like mental health services, educational opportunities, all the things that can help them deal with those challenges and build a better life.
And we need to be pushing for policies that put their well-being front and center from the very beginning. Policies that focus on early intervention, on keeping families together whenever possible. A more holistic approach.
It feels like a lot of this comes down to just changing how we think about the whole thing.
Absolutely. We have to move away from seeing the care system as just numbers and processes. It's about real people with real feelings going through real struggles.
And if we want it to be successful, we have to be committed to the well-being of each and every child. It's a big task.
It is. And it's not something that ends when this episode ends. It's on all of us to keep this conversation going, to get involved in our communities, to speak up for change, to support the organizations that are working to make things better for these kids and families.
I think that's a great point to end on. We talked about the trends, the challenges, some of the potential solutions. But the real work, that starts now.
Right.
So thanks to everyone for joining us on this deep dive. We hope it's given you some things to think about, to maybe even act on. Because ultimately, it's about creating a world where every child has the chance to thrive, no matter what.
Yeah.
And that's something worth fighting for.